first of all, good morning. Thank you everyone for joining us today for our Distinguished Speaker Series. We're very excited to have a wonderful presentation for you today. We have Dr. Mimi Guarneri today, and we also have Dr. Petty Mirdamati, and they'll be joining us today for our lecture, which is The Heart Speaks, Are You Listening? So we're very excited to have them here today. First of all, I want to introduce myself. My name is Nancy Walters. I'm the Executive Director of the La Jolla Community Center. If you're new to the center, we are a nonprofit organization and we serve seniors daily, and we work every day to promote lifelong learning, wellness, and friendship. And we have a lot of programs online daily to fit all needs. So we have everything from Zumba and yoga, Pilates, a lot of classes online. So please check out our website. It's ljcommunitycenter.org to learn more about our center. So without further ado, I'm going to introduce Dr. Guarneri. And Dr. Mimi Guarneri is board certified in cardiovascular disease, internal medicine, nuclear cardiology, and integrative holistic medicine. Dr. Guarneri is the founder and president of the Academy of Integrative Health and Medicine. She serves on the founding board of the American Board Physician Specialties in Integrative Medicine, is a clinical associate professor at UCSD, and is an award-winning physician and researcher. After graduating from SUNY Medical Center in New York, she began her career at Scripps Clinic in interventional cardiology, where she placed thousands of coronary stents. Recognizing the need for a more comprehensive and holistic approach to cardiovascular disease, she founded the Scripps Center for Integrative Medicine and served as medical director for 15 years, where state-of-the-art cardiac imaging technology and lifestyle change programs could be used to aggressively diagnose, prevent, and treat cardiovascular disease. In 2014, Dr. Guarneri co-founded and began serving as medical director of Guarneri Integrative Health, Inc. She has served as a senior advisor for large healthcare systems to develop integrative medicine and wellness centers. I'm going to introduce Dr. Petty Mirdamati now, just so that it's a better flow. But following Dr. Guarneri will be Petty Mirdamati, ND, licensed naturopathic doctor, functional medicine doctor, and holistic nutritionist at Pacific Pearl La Jolla. Dr. Mirdamati is passionate about using food to address chronic disease, optimal wellness, and longevity for seniors and anyone determined to improve energy, fitness, and overall health. So if anybody has any questions throughout the presentation, please feel free to use the Q&A or chat function that you'll see on your screen, and we'll get to those questions at the end of the presentation. So without further ado, please help me welcome Dr. Mimi Guarneri.
Good morning and thank you. I will do a screen share and please do let me know if you do not see the slides. How are we doing there? Are we okay on your end?
We see them. Thank you, Dr. Guarneri.
Okay, thank you for the invite, and I'm so glad Pacific Pearl La Jolla and the Community Center could work together as we're all sort of homebound and right now. Because it's Heart Month, we're going to focus on cardiovascular disease and, quite frankly, how we can get healthy even within this COVID pandemic. So we know 80% of deaths from cardiovascular disease could be prevented. And what you're going to hear about today is the role of inflammation. And then Dr. Petty is going to talk about physical activity and a healthy anti-inflammatory diet. And I'm sure no one on this Zoom is smoking cigarettes. If you are, today should really be your last day. And I think by now we've all learned that we need to transform the way we respond to stress and tension. And the reality is, I think as we age, we get wiser and recognize what's truly important. When you look to the left here, this is the global burden of disease. So in the 1990s, we were worried about childhood undernutrition. We were worried about unclean water, high blood pressure, air pollutants, and smoking. And if you look all the way to the right, you begin to see the diseases of our Western society taking the lead, with high blood pressure, smoking, high blood sugar, obesity being the top four, all of which are completely preventable. And when you prevent these, you also prevent kidney disease, heart disease, cognitive decline, and so on. So everything we say for the heart is going to be important for the kidney, the brain, overall health, and well-being. It's important to talk a minute about climate change because in the Lancet, climate change was called the largest threat in the 21st century. And it also has been called the greatest opportunity that we have, including by Pope Francis. And the reason it's important is you'll see in a minute how changes in the climate are affecting health. And if you just turn on the TV and you look across what's going on in the middle of our country, you can see the devastating storms and catastrophic events. But the reality is air pollution causes cardiovascular disease and asthma. We're starting to see an increase in infections that we never had in our community, such as chikungunya and dengue, Lyme disease, and so on, increasing allergens in the air. For example, what happened right here in San Diego during the fires. If you look on your cell phone, you can see your air quality. Our air quality was in the unacceptable range, over 150. Of course, leading to cardiovascular disease, allergies, and asthma. My focus is not on climate change today, but just to mention that the changes we see, severe weather, extreme heat, impacts on food and water quality, are going to affect all of us. And you'll see in a minute how all of this is connected to how we live our lives. So the World Health Organization declared air pollution an independent risk factor for heart disease, accounting for 7 million deaths annually. And there are some places where you really can't even go out and breathe the air, like New Delhi, India, and Beijing, China. And you may recall Los Angeles was like this many years ago in the 80s, until we decided to put in some tough laws around the emission of pollutants. And we have really managed in California to work on cleaning up our environment. One of the areas Western medicine doesn't talk a lot about is something called persistent organic pollutants. These are the herbicides, insecticides, pesticides that are on our food. This is why we recommend buying certain foods organic, because the residuals from these pesticides can cause something called mitochondrial dysfunction, meaning the strength, the powerhouse. Dr. Petty is going to talk about retaining strength as we grow older, but also it can cause diabetes and high blood pressure. So pollutants are linked to our health. Now, for the first time in our country's history, we have these states here in purple, which you see, Louisiana, Mississippi, Alabama, for example, where greater than 35% of the population is obese. The red states that you see here are not just Republican states, they're actually states where 30 to 35% of the population is obese. And as we talk about our health challenges, we now know, for example, that COVID-19 really is much worse in people with obesity and hypertension and diabetes. And look at what our country is going through right now. We have literally an epidemic of obesity leading to diabetes, high blood pressure, sleep apnea, joint problems, and of course, cognitive decline. It all goes together. So the World Health Organization says that we have had 1.5 million deaths from diabetes in just 1 year in 2012, 10% of the world's adult population. So when we talk about nutrition and we talk about inflammation, one of the first things we need to do is get a handle on diabetes and prediabetes, because it is linked to heart disease and cognitive decline. What the research shows is that as your blood sugar goes up, your brain begins to shrink. Literally, the white matter of your brain gets smaller. We are also seeing an epidemic of something called non-alcoholic fatty liver disease. This is basically insulin resistance in the liver, where the liver starts to get replaced by fat. And it is expected that this will increase by 50% in 2030. Pretty impressive. Now, most of us know in Western medicine that whatever ill you have, whether it's arthritis or depression or high blood pressure, we have a pill for you. But our focus at Pacific Pearl and our focus in the world of integrative holistic medicine is not to just simply name a disease, blame it, and give you a pill for it. Our focus is how can we get to the underlying cause and reverse the process? In the United States, you can see us up top here, we use more pharmaceuticals than any other developed country in the world, and yet we don't live the longest. And part of our problem is we are overfed with junk foods, we are undernourished from those foods, and our environment is suffering from lots of toxicities, not only in the agricultural industry, but also in air quality and water quality. So the way I think about this is, if you go to the left of the screen here, you can look at what we subsidize as a country. We subsidize the meat industry, the grain industry, we subsidize the corn industry and the sugar industry, which then makes foods, quite frankly, that are not totally healthy. We're not subsidizing the things I'd like us to subsidize, like nuts and legumes. Those are just barely at the top of the pyramid, and vegetables, for example. And it's the way we process our food. For example, we take down the trees, deforestation, for example, what they're doing in the Amazon right now, which is considered the lungs of the earth and the planet, in order to graze cattle, which then produce methane. The methane then causes greenhouse gas emissions. We give the cattle antibiotics, we give the cattle steroids to make them fat. And you have to remember, whatever the animal is eating, you are eating. These foods have been linked to antibiotic resistance in humans. At the end of the day, our industry has profound health impacts on us, including creating foods that are addicting. I mean, how many people can put down a potato chip after eating just one? The industry likes to get us hooked on fat, on sugar, and on salt. So the health impacts are huge, and their end result is we jump to the right-hand side of the slide, which is we jump into the pharmaceutical industry, which has one of the biggest greenhouse gas carbon footprints. So we really need to root out, when we talk about root cause, we need to look at the laws that are involved in how we subsidize certain foods and what's going on at a fundamental level. So I encourage everyone to not think about the human body in a silo. You may see the orthopedic surgeon who says, I just look at your bones. Or you may see me as the cardiologist, and some people expect me to just look at the heart, or you'll go to another doctor to just look at the gut. Well, the reality is we don't live in silos. We are completely interconnected, every system relying on the other systems. And if we don't see the human body as a system, we are missing the point. So for example, what I do for the heart is good for the brain, is good for the kidneys. When we talk about inflammation, it affects the brain, it affects the heart, and so on. So when we think about the origins of disease, we talked a little bit about toxins and chemical exposure. I'm not going to lecture a lot today on stress, but emotions like anger can increase the risk of a heart attack, for example, 230%. We say what you think about expands. How you think, where you spend your time, and who you spend your time with can affect your health. The choices you make in nutrition. Are you choosing to have green leafy vegetables, or are you choosing to have plain white rice? Are you choosing to have whole grain bread, or are you having whole wheat bread? What are the choices that you're making with your nutrition? And right now, right here in La Jolla, there's too much alcohol use. We need to chill that down. People say, well, I'm home, I'm bored. Alcohol is pure sugar, not good for your joints, not good for your brain. what I'd like to see everyone do is get out and start walking, put your face mask on and start to move as much as you can in any way possible. Drugs, alcohol, emotional traumas, tobacco, all these things interact with all the systems in our body and interact with our genes, ultimately determining if we're going to be healthy or we are going to get sick. So these are all the areas I need you to think about when you're thinking about being healthy. Did I get a good night's sleep? Did I eat well today? How am I handling my emotional life? Am I depressed? Am I anxious? Do I have, am I feeling stressed out? Maybe I need to get some help for that. Am I still smoking cigarettes or drinking too much? Only we know what we're doing as individuals. There's a good chance your partner knows what you're doing. So when we talk about the heart, we say that cardiovascular disease is an inflammatory disease. It does not matter what we do to the blood vessel. It could be high blood pressure, it could be diabetes, it can be infections, it can be environmental toxins. We get three responses: inflammation, oxidative stress, and immune response. And everyone now is experts on the immune system, since I love it that everyone is talking about immunity and COVID. But at the end of the day, the vascular system gets affected, the lining of the blood vessel, what we call endothelial dysfunction occurs, and that leads to the laying down of plaque. So what Dr. Petty is going to talk about today is how we dial down inflammation and oxidative stress. Well, this is the first cause of inflammation: carrying weight in your midline, visceral fat. Visceral fat is different from subcutaneous fat. Visceral fat is an endocrine organ. It produces inflammatory cytokines. It produces angiotensin II, which raises your blood pressure, tumor necrosis factor, interleukin-6. All of these lead to cognitive decline and arthritis and heart disease. So just getting that extra weight off your midline has a profound effect on your body. The more inflammation we have, the more we damage the so-called bad cholesterol, the LDL. It's not LDL that's always the enemy, but oxidized LDL, LDL that has been damaged by inflammation, is what damages the lining of the artery, and that leads to the laying down of plaque. The research tells us this over and over again. So for example, if you take two people with the same LDL cholesterol level, and they have an LDL cholesterol level, let's say less than 70, but the CRP, the marker for inflammation, is greater than 2 versus greater than 1. You see those two curves on the bottom. The LDL is the same, but the one with more inflammation has more cardiovascular events. The more inflammation you have, the more cardiovascular events you have. So we know when you go to the doctor tends to focus on the right-hand side. Let's get the weight off you, get blood sugar down, let's give you something for your cholesterol, and that's all great. Well, what we encourage you to do at the Pearl is to go upstream. Identify what's causing the problem. Is your genetics a piece of the puzzle? Is it interacting with your environment? What lifestyle choices can I make to decrease oxidative stress, improve my vascular function, clear up all that excess insulin, which is making me fat, transform my autonomic nervous system, right? That's the part of the nervous system when we're anxious and stressed that gets all fired up. And how can I decrease inflammation? It's all connected. And the answer is in your environment and in your lifestyle choices. So for example, we know that a healthy blood vessel produces something called nitric oxide. And we can measure this here at the Pearl with a simple test called an endopath. That tells us, does your vessel dilate? Is it healthy? As opposed to this guy, angiotensin II, which causes thrombosis, blood clots, it's pro-inflammatory, and is a pro-oxidant, damages the blood vessel. The difference, I have a healthy blood vessel able to dilate, able to ward off clots, versus a blood vessel that's constricted and damaged. So we know, this is a slide I actually use for doctors. When I teach them, I say, okay, so what is your life made of? It's made of how you sleep, how you move, your micro and your macronutrients. Micro meaning what are your vitamins, intracellular minerals. We can measure all of these things. How do you respond to stress? Where are you at emotionally, mentally, physically, and spiritually? All of these things you can see in these little drop-down boxes, which are the way I teach it to the docs. Hey, do we need to check you for sleep apnea? Let's make sure your fasting blood sugar and your 3-month blood sugar and your insulin look good. Let's look at some advanced cholesterol testing. Let's make sure we check your urine for protein. Is your kidney being damaged by blood pressure and diabetes? Let's take a look at your whole autonomic nervous system. Let's take a look at how you're handling stress. And then let's look at some of those specialty items that cause blood to clot, like the genetic test for Lp(a) and homocysteine and so on. So all of these things, including testing for heavy metals, lead, mercury, and cadmium, all of these things can lead to cardiovascular disease. And our job is to peel back the layers and get you on a path to health. So here are some signs that you may be having some health challenges. This ring around the eye is called an arcus senilis. It's a white ring of cholesterol deposition. So when we see that, we say this person probably has very high cholesterol. Gray hair before the age of 55 is a sign of nutrient deficiencies and a sign of oxidative stress. So just looking at this woman, we know her cholesterol is high. We know she's been through a lot of stress, and looking in her eyelid tells us she's also anemic. So we're interested in knowing her entire nutrient status, which can be obtained with a simple blood test called a Nutri-Eval. This gentleman has an advanced problem of cholesterol. He has actual deposits of cholesterol on his eyelids and all around his eye, what's called xanthelasmas. Again, a warning sign that we're dealing with very high cholesterol levels. And this is another sign. These black patches that line the neck or in the armpit are associated with pre-diabetes, insulin resistance. So again, looking at the body really gives us a lot of information, and information about inflammation, about insulin resistance, and about nutrient deficiencies. I don't know when the last time your medical doctor looked at your teeth. We think the mouth holds an enormous amount of information. You can see here these rings around the teeth. These are what's called Burton's rings, which are associated with heavy metals. Teeth that are completely inflamed with periodontal disease are linked to cardiovascular disease, linked to inflammation. Gingivitis, periodontal disease really needs to be treated. Very serious for the heart. One study demonstrated that 50% of heart attacks are triggered by mouth infections, and most doctors don't look in the mouth. This is something else you may have in your mouth, mercury, and it may or may not be making you sick. And don't think I'm going to go take all my mercury out. That's a conversation we want you to have with a biologic dentist. And we also would want to measure your mercury levels. Now, most people know when they go to the doctor, I'm going to get my blood pressure checked, I'm going to get my heart rate checked, but we also want you to get your waist circumference checked. And we want you to have something called a waist to hip ratio, because if that number is greater than 1 in men, greater than 0.85 in women, that waist to hip ratio puts you at high risk for cardiovascular disease. So this is what an apple-shaped body looks like. This person has too much visceral fat, what we call that. This person is shaped more like a pear and has too much subcutaneous fat. And the risk is different. The person with the visceral fat has a higher risk. So how do we determine this? Well, you could do something called a body mass index, but that just looks at height and weight. So this guy who's in great shape would have a high body mass index because he's all muscle. But we have a technology called a bioimpedance analysis, takes all of 10 minutes, that allows us to know your basal metabolic rate, how much fat you have, how much muscle you have, and so on. And this can help us determine how many calories you need to burn, how many calories you should decrease to hit your target weight. I put this slide in because a lot of people think a high blood pressure of 130, 140 is normal. It is not. 120 over 80 is our goal. When we hit that 130 to 139, we call that stage 1 high blood pressure. And there are ways for us to treat this, both naturally and with medication. And as clinicians, we're very interested, again, this is a slide I use for the docs, we're very interested in looking at, is the blood pressure high in the morning? Is it high at night? And which systems of the nervous system are causing these rises in blood pressure? Well, what's important for everyone to know that each pound of weight you lose drops your blood pressure 1 millimeter of mercury. So 10 pounds of weight means 10 millimeters of mercury, or a decreased risk in cardiovascular events of 20%. So let's get walking, let's get moving, let's get off the salt, and let's get those extra pounds off. So we talked a little bit about C-reactive protein. It's a marker for inflammation. I just want you to know, when you go to your doctor, make sure you get an HS-CRP. You want to know where your inflammation levels are at. You also want to know, do you have damaged LDL or oxidized LDL, as we showed earlier, which damages the lining of the blood vessel. This oxidized LDL turns on something called NF-kappa B in the nucleus and produces all sorts of inflammatory cytokines. You also want to ask your doctor for something called an LDL particle number. This is a much better predictor of risk of a cardiovascular event. If you have a lot of small LDL particles or a high number of particles, you are at increased risk. So when we do an advanced lipid panel, we're looking at all of these numbers. More small particles, more risk. So two people can have the same LDL, but one can have large particles and one can have small particles, and the one with the small particles is at higher risk. The other test we can do is something called an ApoA and an ApoB blood test. You can think of B as the bad boy, A as, wow, I got an A on the test, that's a good one. And we know that as the ApoB goes up and the ApoA goes down, the risk of cardiovascular events continues to rise. So this is a great ratio for us to follow. Genetically, we also like to test for something called Lp(a), which runs in families, especially in families that have early cardiovascular disease. It's an independent risk factor, and it's important that we check for it. Now, this is an example of someone with a very high cholesterol, 283, with lots of small particles. Here's the LDL particle number, 2,224. This number should be less than 1,000. And honestly, to fix this guy, we just need to get him to lose weight, get off the sugar, including the wine, get moving, and get off the simple carbs. All fixable, but this is a very high risk lipid profile. The last one I'll talk about is the good cholesterol, the happy cholesterol, HDL. Not all the HDL does what it should do. HDL should pull plaque out of the vessel like a garbage man, but some of the HDL doesn't work. And we need to check for what's called functional HDL. HDL that's been damaged by inflammation is dysfunctional and does not work. So if you are a woman out there who has been told by your doctor, don't worry, you have a high HDL, let's make sure that HDL is working. So I'm going to end here with this concept of laboratory testing and advanced inflammatory markers that all should be done for looking at cardiovascular risk, including this test, which is called a pulse score. The pulse score is so unique that it's a simple blood test that can tell you what is my risk in the next 5 years of having a cardiovascular event. Is my risk 2% or is my risk 40%? And you know what I'm going to say, we need to get changing our lifestyle when we find these high risk numbers. So lifestyle is an intervention. Don't let anyone tell you different. And I'm going to turn it over to Dr. Petty, who's going to talk to you a bit about that. Why don't we take a question or two while he's sending me his slides, and then we'll get him set up.
Sure. So there's a question that says, does sugar increase cholesterol levels? How does that work?
Oh, that's a great question. Sugar increases triglyceride levels. So the form of fat that is carried, that sugar is carried by, is called the triglycerides. So when you eat too much sugar, your triglycerides will go up. What will also go up is your LDL particle number. Remember those particles I said? So you should really get your sugar down to below 20 grams a day. And I recommend no added sugar in your diet. So as you can see in this nice picture, you want your sugar maybe to be in the form of healthy fruit, but certainly not fruit juice and certainly not soda. And you got to cut back on that alcohol, which is all sugar. And all the white stuff gets converted to sugar.
Great. One more question is, what do you do when you have your blood pressure fairly under control, but you can't control the spikes?
I want you to pay attention to when you spike. So some blood pressure medicines, some people can take that blood pressure in the morning, but the medicine doesn't really last until the night. So sit down in the morning, feet flat on the floor, arm at heart level on the table, check a blood pressure with a proper arm cuff, not a wrist cuff, and mark your AM and your PM blood pressure. Let's see what's going on. Is your blood pressure medicine not working? Are the spikes coming in the morning because you have sleep apnea at night? You know, we need to really look through, is it because you're angry and stressed out? What's causing you to have these spikes? Now, what I taught a patient yesterday is black licorice, black jelly beans have something in it called glycerinic acid, which raises blood pressure. So very, very important to get off that black licorice. Keep your sodium down to 1,500 milligrams a day. Throw your cell phone in your pocket and record your steps, 10,000 steps a day. And really pay attention to where your salt is coming from. Is it in pickles? Is it nuts with salt, chips with salt, deli meat? Pay attention to all of those things.
Great. There is another question. Do you have a list of tests we should be sure to ask our doctors to take each year?
I do. The first would be a comprehensive metabolic profile, which would give your kidney and liver function. The second test would be a CBC with a differential, which gives us your blood count and a differential of the type of white cells you have. you should have an HSCRP for your marker for inflammation. You should have a homocysteine level. I'm happy to give, when I did the PBS special, Live Better Now, I created a lab slip for people. So I'll be happy to have Susan give you that slip so you can post it for your community center group if you would like that. I mean, there's a lot of things I recommend, including thyroid function, a full lipid profile called an NMR lipid profile, a vitamin D level. These are the basics.
Absolutely,
Okay.
Dr. Guarneri. We can send those out to the attendees.
And I'll turn it over to Dr. Petty.
Sure. Thank you, Dr. Guarneri. All right. Hello. Thank you for having me. Very excited to talk a little bit about nutrition and lifestyle for cardiovascular health and overall well-being. Can everyone hear me okay?
Yes.
Great. Okay, so I'm just going to begin by piggybacking some of the things that Dr. Guarneri mentioned. So we're going to start by talking a little bit about the power of using food as medicine, because food can truly be the greatest form of medicine. When you think about it, in the course of a year, we have about 2,000, 3,000 pounds of food in a year. And when you think about it, that's so much food that the body has to process. So food can truly be the greatest form of medicine when used appropriately. And next, we're going to touch a little bit about maintaining strength with movements and talk about the power of movement and exercise. So to begin, like Dr. Guarneri said, inflammation is the enemy. Inflammation is fire in the blood vessels and the root cause of many disease. And so what we want to do is we want to be mindful of the foods that are potentially contributing to inflammation and reduce those, meanwhile encouraging and eating as much foods that are anti-inflammatory as possible. And I'm going to touch on each one of those points shortly. Also, inflammation, we mentioned, is fire in the blood vessels and the root cause of a lot of disease. But what does inflammation feel like in the body to us? Well, inflammation can make us feel tired. It can cause joint pain. It can cause brain function. So these are all things that manifest as symptoms in our body when we are inflamed and eating a lot of food that is inflammatory. So it's very important to be mindful of these symptoms. So what are some foods that are inflammatory versus foods that are anti-inflammatory? Well, as Dr. Guarneri mentioned, sugar is very inflammatory. Alcohol is very inflammatory. Processed foods, packaged foods, all those things are inflammatory. And for some people, dairy can be very inflammatory. So those are the top culprits when it comes to thinking about foods that cause inflammation in the body. On the other hand, there are anti-inflammatory foods that reduce inflammation, and those are plant foods. Plant foods have lots of phytonutrients. The bright colors that we see in plant food are so many phytonutrients that have profound benefits for our health and can be very anti-inflammatory. So we want to eat as many plant foods as possible, ideally different colors. What I like to tell my patients is aim to eat the rainbow. Try to have different colors, because each bright color is an indication of a specific group of phytonutrients that has very powerful health benefits. And next, the other group of foods that are very anti-inflammatory are the healthy fats. It's important to be able to distinguish between the healthy fats and the unhealthy fats, so I just want to spend a second doing so. The unhealthy fats are things that are deep fried, the fatty animal products. Those things are very inflammatory. But the anti-inflammatory fats, the healthy fats, come from things like avocados, nuts, seeds, olive oil, wild-caught fish. Those are all excellent sources of fats, healthy fats that could actually be anti-inflammatory and help support the brain, can help support many biological functions. So let's get into a little bit about the specifics of the foods that we want to avoid to minimize inflammation. The top culprit is the sugar. And one thing that's important, like Dr. Guarneri said, a lot of us are sitting at home with everything going on. So, alcohol consumption has increased. So We need to be mindful of that. And alcohol, wine, things like that are just so high in sugar that just drive up our blood sugar. And we want to minimize that as much as possible because these simple sugars are really creating inflammation in the body. Next are sodas and fruit juice. On the surface, fruit juice might appear to be healthy, but fruit juice, what has happened is that they've removed all the fiber from it, so it leaves just behind isolated sugar. So what I recommend my patients, if you want to have some juice, make it yourself at home. Throw a bunch of fruit and some water in a blender and drink it all. Don't separate out the fiber, drink the fiber. The fiber has lots of benefits, and we're going to touch on some of those benefits shortly. The number two inflammatory food are fried foods. Anything that's deep fried or hydrogenated, those are going to really cause inflammation and increase our oxidative cholesterol, which is something that we do not want to increase. So be mindful of fried foods, avoid them entirely. Next are processed foods, things that are packaged and highly processed. So unfortunately, the food industry has gone towards really being dependent on processed packaged foods with ingredient lists that are just so large with ingredients that we can't even recognize anymore. So it's important to lean away from that and go always towards whole food, in its natural form, the way God or nature intended it to be. So when it comes to making a distinction as to what's healthy and what's not, what I tell a lot of my patients is ask yourself, was this food made by man? Meaning, is it processed? Is it in a box with a huge list of ingredients? Or was it made by nature and God and just in its whole real form? And I think that's such an important rule of thumb to keep in mind when deciding what's healthy and what's not. And last but not least, the fourth food source of inflammation is dairy. A lot of people are very sensitive to dairy, and this can cause inflammation in the body. The top culprits are cow milk. That's a common one that we see in practice, as well as cheese. So we want to be mindful of your dairy intake and keep that to a minimum as well. And a way to make sure to test if you are sensitive to dairy or not is to do something called the food sensitivity test, which is a common test that we do here in the practice, which takes the patient's blood, exposes it to different foods, and we see whether or not that patient's immune system reacts to that food and it triggers inflammation. So that's a very personalized way to determine if some of these foods, like dairy, cause inflammation in the body or not. Moving on to the anti-inflammatory foods, as we mentioned, plant foods, the fruits and vegetables, that's where we want to focus. Ideally, we want half of our plate to be vegetables, different colors, fibrous vegetables, because these foods, the pigments, as we mentioned, have very powerful anti-inflammatory benefits for the body. And as I said, the healthy fats like the olive oil, nuts, seeds, avocado, wild-caught fish, these are all excellent anti-inflammatory foods and the basis of the Mediterranean diet, which is one of the most powerful diets when it comes to addressing cardiovascular disease. I love nuts and seeds because they make a great snack for me. Every day I load up a bag full of nuts and different seeds, and I take that to work with me and I just have it in my bag. It's very delicious, it's healthy, and a quick snack that I could just, throw back if I'm not in close distance to anything to eat. So I highly suggest that to you to try. Make sure you have healthy snacks with you if you're going on the road. This makes it less likely for you to, stop by at the gas station or the convenience store and pick up something that's unlikely going to be healthy. And last but not least, I just want to touch on the importance of fiber. Fiber is so incredibly important, and we get most of our fiber from plant food, fruits, vegetables, and legumes, beans, lentils. Those are all excellent sources of fiber. And fiber is very beneficial because it helps keep blood sugar stable. When we have fibrous foods with carbohydrates, it prevents the blood sugar from spiking as high. And we want to minimize blood sugar spikes because that's detrimental for our health and very inflammatory. So by having fiber with our meals, what we ensure is more stable blood sugar throughout the day. Fiber also helps lower cholesterol. And lastly, fiber also helps with bowel movements. Having regular bowel movements is incredibly important for optimal health, and fiber in combination with water are very important aspects for ensuring regular bowel movement. So moving on, I think that breakfast is one of the most important meals of the day. The word break, fast, it tells us that we've been fasting overnight. Now we have to break it. So that's where the word came from. And so it's important to get a healthy, nutritious, well-balanced breakfast to start your day, because that's going to set you up for success and prevent your blood sugar from crashing later on and leading to you eating something that you shouldn't really have. So a quick and easy and delicious way to start your day is having a quick breakfast smoothie. And here I've provided you with a recipe that you can make. This is one of my personal favorites. I like to add a couple of organic berries, whatever type of berry you like, a mix, doesn't really matter, but try to keep them organic, because like Dr. Guarneri said, the pesticides are something we want to keep to a minimum. And berries are a very dirty fruit, meaning that they're heavily sprayed. And a good resource to understand, which fruits are safe to eat non-organic versus which fruits and vegetables you want to eat are organic are the EWG, the Environmental Working Group's Dirty Dozen and Clean 15. So if you go on ewg.org, you could see that every year the Environmental Working Group releases a list of fruits and vegetables that they consider dirty dozen, meaning they're high in the fruits and vegetables, or clean 15, meaning they're low in the toxins and chemicals. So that's a good way for us to distinguish which foods we should ensure and make sure are organic and which fruits and vegetables are okay if they're not organic. So I highly recommend checking that out. If you do a Google search, EWG Dirty Dozen, you'll see different pictures of it. So in my smoothie, I put the organic berries, I put some greens because they're a great source of nutrients, and then I put some healthy fats in the form of some almond butter or an avocado, a slice of an avocado with some plant protein powder, and I use some non-dairy milk, blend it up, drink it, tastes very refreshing, gives me protein, gives me fat, gives me fiber, and it's lower in sugar, and the sugars are all coming from berries, natural form, and it's delicious. And so it takes 2 minutes to make, 2 minutes to drink, and you've started your day off on the right foot. So now that we've talked about food, I just want to spend a couple of seconds talking about movement and the importance of exercise and movements for overall health and cardiovascular health. And we live in San Diego, so we're very blessed that there's a lot of things we could do outside here. So we get to walk in nature, which has so many health benefits being outside. Put your mask on, go outside, get fresh air, breathe the nice weather and take it all in. And this has such incredible healing benefits for us. And being in San Diego, like I said, we're very blessed to have access to this all year round. Another thing that's excellent is hill walking and hiking. Hill walking, when we're going on a little bit of an incline, a little bit of an uphill, it adds a little bit of a resistance weight-bearing component to it, which has additional benefits for our bones. So moving and exercise are not only incredibly important for cardiovascular health, overall health, but they're incredibly important for our bone health. And that's something that we always keep in mind here when working with our patients, especially those that are postmenopausal. And so doing the walking, especially on a little bit of hill, that's going to really help strengthen the bones if that is something you're comfortable doing. And stairs could actually be a good form of exercise too. So if you have access to staircase, if you're comfortable, your knees feel comfortable, walk the stairs, go up the stairs, challenge yourself. This is going to help strengthen those big muscles in your legs, and that's where the biggest muscles in the body are. So we want to really try to maintain the muscle size in our legs, because that's going to be really helpful for our longevity. And last but not least, if we have access to it, of course, we want to do weight-bearing exercise in the form of resistance bands, body weight exercise, whatever it may be, just something that helps preserve our muscle mass because muscle mass is incredibly important for brain health, for bone health, cardiovascular health, and so much more. So just to summarize, like I said, the benefits of movement and exercise are great for cardiovascular health, bone health, brain health, and overall health. So I hope this was helpful for you. I hope there was some lessons in this that you could take, implement into your life. And if there's any questions that you have, if there's any way I could be of service, my email address is right here at the bottom, and I would be more than happy to address any questions that you may have. Thank you for having me.
Thank you so much, Dr. Petty Mirdamati. The email address, it might show a little bit small, but it's pmirdamatind@pacificpearllajolla.com. You can also find more information on their website. It's pacificpearllajolla.com. They're on La Jolla Boulevard, super local in our community, a huge staple in the community. So please visit that, visit their website, and you'll be able to find more information about any testing that they do. But we'll go for a few questions. So here's a question. There's a question regarding fasting and keto. Can you elaborate on those two concepts?
Go ahead, Dr. Mirdamati. We have to maintain some level of social distancing from each other. So I'll let Dr. Mirdamati take that question, okay?
Perfect.
Sure, those are actually two really hot topics nowadays in nutrition and medicine. So thank you for asking that. As far as fasting is concerned, there's a lot of research that shows that there's benefits to fasting. There's different ways you could fast. One is, you just fast for 13 hours overnight, and then there's more extended ways to fast. To get the most out of fasting, it depends what your goals are really. But, ideally, something that we recommend a lot of our patients is to avoid eating anything after dinner. Because what happens is if you eat too close to bedtime, that's going to disrupt sleep. It could lead to weight gain, and it's not very good for the digestive system. So by doing a 13-hour fast overnight, we're giving a break to the digestive system from processing anything, and that could be really beneficial. And so that's as fasting is concerned. As far as keto is concerned, keto, for those that don't know, is just a type of diet that is very low carbs, in fact, almost no carbs sometimes, but high fat and high protein. And it could work for some people, but what we've seen in practice is that some people, if they have a genetic predisposition to it, it could lead to elevated cholesterol and LDL because of the high fats. So if you are doing a keto-based diet, it's important to work closely with your doctor and have them monitor your lipids, because your lipids can increase. It's just personalized at the end of the day. Some people can really benefit, but others need to be supervised and watched just to make sure that their cholesterol and lipids aren't going up too much with the additional fats that they're taking in all the time.
Great, thank you. Another question is, does blending negatively affect the benefits of our food?
Good question. Not for the most part, not that I'm aware of. That's something that I try to keep in mind when I'm making my smoothies. I try not to over blend. I just blend enough so that I can get it down. But I'm not aware of that. Dr. Guarneri?
They can add fiber to the smoothie, which goes really well. Add some chia or flax or hemp. That way they're getting the fiber as well. You can just add it in, and then it has added health benefits.
Absolutely.
Great, thank you. Another question, what is the ideal muscle mass?
Go ahead, Dr. Petty. This is your sweet spot.
What is the ideal muscle mass? Well,
talk about percent body fat too.
Oh, sure. Yeah, I think
that's what I think they mean. Yeah.
Right. So I think that depends on males, females, age as well. But for men, you want to be anywhere from, I believe, 14 to 18 body fat percentage, and women a little bit higher than that. That's how we gauge body composition. We do something called a BIA here that tells us how much muscle mass, how much fat, how much water a patient has. And from there, we're able to work towards the patient's ideal weight. So we focus more on body fat and body composition versus muscle mass per se.
Great. Another question is, what about having eggs for breakfast? And they added hard boiled or fried, but I think we know what you're going to say there. But what do you think about eggs for breakfast?
I think eggs are fine in moderation. They're fine. Ideally, you don't want to fry it in some bad oil. You know, you want to use a healthy oil alternative, which is something I should have mentioned. Actually, your oils that you use can be very anti-inflammatory or pro-inflammatory. So you want to avoid using the vegetable oils like canola oil, safflower oil, those oils, and lean more towards olive oil, avocado oil, the healthier oils. So if you're frying it in a subpar oil, it might not be the best. But if you're using, you know, olive oil or avocado oil, organic eggs in moderation, I think it's a good breakfast option that helps provide protein and fat for sure.
And another option is a poached egg. Poaching an egg is probably one of the healthiest ways you can go because it doesn't produce what's called age-glycated end products, which happen when you scramble an egg. So poaching is a great way.
Great, thank you. We'll just take one more question. I know we're at the 11 o'clock mark. What is the cost of comprehensive testing that you've described, Dr. Guarneri? I know you have a lot of information on your website, which again is pacificpearllajolla.com. Are those listed on the website, or can you elaborate on that?
Testing depends on your insurance. For example, anyone who has Medicare can have testing done at the Cleveland Heart Lab, which is what we use for all of our advanced cardiac testing. The pulse score that I mentioned is covered by Medicare. The nutrient evaluation is covered by Medicare. The microbiome test is covered by Medicare. So we can get a lot of testing under insurance. The key is not to get the testing alone, but really to sit with one of us and have it interpreted and then put together a lifestyle program, a nutraceutical program for the individual. A lot of people, what we see here is people go out and have all sorts of tests, but then no one knows how to piece it all together. But if you have Medicare, a lot is covered.
Great, thank you. I also want to mention, I have this wonderful book, 108 Pearls by Dr. Guarneri. If you don't know, she of course is also an author, and you can find this book on Amazon, or what about on your website, Dr. Guarneri? Is it on Pacific Pearl or Amazon?
Right, so it's on the website as well. It's on Amazon. It was just made into an audio book, which will be released shortly. Also on the website, we have a recipe book. And if people go to the website, they're welcome to all our free recipes, which are in our resource center. We have beautiful recipes and videos and everything that's right there for anyone who needs.
Wonderful. Dr. Guarneri, Dr. Mirda Mahdi, thank you so much for joining us today for our Distinguished Speaker Series. We're very happy to have had you join us. Thank you for all the knowledge you've imparted on us. We appreciate it very much. Thank you all for joining us again, and have a wonderful day. Stay safe, stay well. Take care.
Thank you. Bye-bye. Take care.